Hi, everyone. My name is Shannon Kettler. I'm with the Media Relations Department here at Cincinnati Children's. Thank you so much for joining us here today. We are here to answer your questions about the COVID-19 vaccine, and joining me today is Dr. Patty Manning, Chief of Staff, and Dr. Mary Carol Burkhart with Cincinnati Children's. Dr. Manning, do you want to start by giving us just a little background about yourself?
Sure. Hi, welcome everybody. So my name is Patty Manning. I'm actually a developmental pediatrician by training, which means I have worked clinically with children with a wide range of developmental disabilities, including autism spectrum disorder, for over 25 years. And I'm the Chief of Staff here at Children's Hospital.
Dr. Burkhart?
I'm Dr. Mary Carol Burkhart. I'm a pediatrician here at Cincinnati Children's and have been here for 10 years. I oversee our academic primary care locations and clinically practice at our Hopple Street location.
Well, we're going to ask you, if you're watching us at home, you'll see a Q&A box at the bottom of your screen. We ask that you please submit your questions to us in writing versus raising your hand. It'll be easier for us to get to all of your questions. So we're going to get started. Dr. Patty Manning, I know we've received a number of questions about parents who have hesitancy. What would you say to parents who may be questioning whether or not to get their child vaccinated?
So the first thing I would say is I appreciate that it's an important decision. Anytime you decide to do anything with your child, vaccinate them or use a medication. And so I have great respect for the fact that that parents take this decision very seriously. The second thing I would say is that it's a very safe vaccine. We've had a front row seat to the trials, to the studies that have shown us both the safety and the efficacy of this vaccine. Our own local children in our neighborhoods, in our community, have participated in these trials, and they've done very, very well. We've seen tremendous effectiveness, and that children have been protected. And then the third thing I'd say is that I wish I could promise you that even though COVID has been mild in children, I wish I could promise you that your child won't get COVID. And I can't promise you that. And I also can't promise you that if they did get COVID, that there couldn't be a serious complication that could happen. And so I feel very strongly that we need to do everything in our power to protect kids, as well as all the protection that we've already given to adults.
So one of the questions we got is, if your child has had COVID, can he or she still get the vaccine?
That's a great question, and we hear that one a lot because parents obviously want to make the right decision and know what the right thing to do is. We do know and definitely recommend that even if your child has had COVID, that they are still eligible for the COVID vaccine, and we recommend that they get it. We don't know how long the immunity from natural infection or from having the COVID infection lasts, but again, we know how effective the vaccine is. So the best way to protect your child, even if they have had the disease COVID, would still be to get the COVID vaccine as well.
Can those who are vaccinated give the virus to those who are not?
So this is one of the main reasons we feel so strongly that people be vaccinated and that people actually still continue to be safe and thoughtful in their practices, because theoretically, yes, if you have the vaccine, it is not 100% protective. No vaccine is. It's about 90 to 95% protective. And so there's a chance that you could get COVID. Your symptoms could be very mild or not even present, but then you could actually transmit COVID to somebody who can't be vaccinated or who hasn't been vaccinated. So it is possible, certainly much less likely, but possible.
Is there any idea of when the vaccine might become available for children younger than age 12?
It's a great question as well, and we don't know the specifics or have a specific answer. We do know that the trials in those younger age children are currently ongoing, and I think anyone's best guess is hoping by early fall that it could be available for younger children as well. But that also depends on what the results of those tests and trials are. We know that nothing will be pushed forward unless we are sure that it is safe and effective, like Dr. Manning said, in those younger children as well.
Is it expected that Moderna and Johnson Johnson vaccines will be approved for children ages 12 and older?
So there is ongoing work. I know definitely with Moderna, less so with J&J, but I would be surprised if both of those vaccines didn't have efforts to move into these younger age ranges. This is pretty common practice for just vaccines and medications in general. They start off getting tested in adults, and then it takes a little longer for them to work the trials down into children. But I have every reason to believe that would be the case for all the COVID vaccines.
So we received a number of questions about masks. The CDC says that fully vaccinated people will no longer have to wear a mask in most indoor-outdoor situations. Should patients with compromised immune systems and high-risk patients who are already fully vaccinated continue to wear masks indoors and in large crowds?
It's a really great question, and I think one that's coming up, so often right now, given the CDC's recent announcement on this. I think that's one of the most important reasons that we can encourage vaccination, is because the more people we get vaccinated, the more steps forward we're going to be able to take as a society. I think there's always caveats with general recommendations to the general public, and people need to do what they are most comfortable with, especially when it comes to people who have immune deficiencies or immunocompromised states. Certainly the safest and most conservative thing would be, yes, to continue wearing your mask if you are concerned about any of those things. That's never going to be a wrong answer. And so I would highly encourage somebody worried about that to continue doing that if they needed to. That being said, we know vaccination is so effective and important that, again, that is a way that as a society we can move forward. But we need to take things slowly, and the rates in your particular community are going to be really important to inform that, which is a challenge with kind of national sort of guidance. Rates, and each community is in a different situation right now related to COVID. So taking into those local factors, I would strongly encourage, as well as the personal factors.
My child's school just recently voted to allow masks to be voluntary for all children in grades and staff. Do you guys think this is safe?
So this is a really important question, because the CDC recommendations specifically say that people who are vaccinated can be unmasked. And we know that for many children, vaccination is not an option. And so some recommendations are starting to look at, well, if you have a child and you're an adult who's vaccinated, but your child is not, then perhaps you should continue to wear a mask because your child should continue to wear a mask. I'm going to assume that when a school makes a decision, that they have worked together to look at all the local factors, and they know their local circumstance better than anybody else, and that they're making that decision for the school in an informed way. But what I like about something that's voluntary is that children can still wear masks if the family feels strongly about that, or if the child feels strongly. It does set up an interesting dynamic, but I think that's where we may be as a society moving forward, is that some people will wear masks and some people won't. And I think we'll all be okay with that.
So we also have a number of questions from parents whose child has a genetic condition. This one parent asks about their child who has factor V and a deep vein thrombosis. Should their child get the vaccine with the risk of blood clots?
What's really great about this is that we know children who have other comorbidities tend to be the ones that are at highest risk to have complications of the COVID-19 infection. And we know that the vaccine is safe even for children with chronic conditions. So they tend to be the children who are going to most benefit from receiving a vaccine. That being said, certainly I don't know your child's specific condition, so I would highly encourage you to talk to your regular healthcare provider for your child and make sure that you get the most appropriate information for your specific situation. But generally speaking, these chronic and comorbid conditions that children have are not a reason that they should not get the vaccine. We actually encourage them to.
We've also received a number of questions about fertility. What do you say to a parent who has concern about whether or not the vaccine impacts a child's fertility?
This is such an important question because it's really circulating a lot. And the first thing that I say is it's not true. I mean, just simply, basically, it's not true. Now, I worry that kind of answer can sound a little dismissive because it's an important question, and certainly any suggestion that something like fertility could be affected should be taken seriously. The reality is that this theory, and that's what it was, it's a theory circulated early on, actually overseas, when there was recognition that there was a very mild similarity between components of the vaccine and components of the human placenta. And so from that recognition of a little bit of similarity was this theory that there might be an effect. It's never been proven. There is no evidence that fertility's been affected. Fertility rates haven't changed. Many women during the COVID trials, even though they were instructed not to, became pregnant after receiving the vaccine. And we certainly have seen people get COVID and be pregnant or get pregnant. So there's so many reasons why we can say that this isn't true. And yet I appreciate that suggestion is something that makes parents worried and nervous. So I'm really appreciative when people ask about it and ask for clarification, but I can say very confidently that it's not the case.
I think too, it's also important to know that even though the COVID vaccine itself is new, the technology, the mRNA vaccine, specifically for the Pfizer vaccine, that technology is not new, and vaccination is not new. And we have a good long track record with vaccinations, and no other vaccinations affect fertility. It's just not the mechanism of action of how this works. And so sometimes I also explain that to families as well, because as Dr. Mannion said, it is important to families, and obviously, it's a concern, but this, I agree, this is one that's just not true. And so helping families expel that myth when it is so prevalent on social media right now, I think is really important.
Another question is about my child's hormones. My child's going through puberty. Does the vaccine impact puberty in any way?
It does not. We give other vaccinations during puberty as well, and we know that those vaccines also do not affect, hormones or puberty itself. So I also would feel confident, even though we're giving this vaccine currently in adolescents, that it's extremely safe and does not affect those things.
Is there a possibility that side effects from the vaccine may present themselves months or years down the road?
A great question, and another fair question around something that's new. And so far, our experience has been that that's not the case with these vaccines, or really any vaccines. Vaccines tend to do their job, and then they're kind of done with their job, which is great. So they don't hang around and linger in your system for long-term sorts of issues or effects. So no evidence that there's anything to worry about long-term. Now, in contrast, I would say COVID as an infection, we're still learning about the long-term effects that can occur in adults and in children who've had COVID, whether that's on their breathing or on their fatigue. And that's different, because when you've had a disease and an infection, that's actually different than the reaction that's triggered by a vaccine. So really important question, not concerned about it for the vaccine at all.
What, if any, are the side effects for children from the vaccine versus adults?
This is a great question, I think really important, so that you know what to expect, and your child also knows what to expect if they're asking these questions. The side effects from the COVID vaccine are similar in adults and children, and they're the common things that you can expect after many other vaccines as well. So often you could have a sore arm or redness around the injection site. You might have a little bit of fatigue, a little bit of a headache the next day, a little, being more tired. We recommend using over-the-counter pain medicine like Tylenol or ibuprofen if your child is experiencing any of those mild side effects. Certainly you can call your child's provider if any of those side effects seem to last longer than a few days. We have not seen much of that, and the over-the-counter medicine tends to address those side effects. We also have seen many adults, and now some of the children, who have absolutely no side effects at all. So it's good to know what to expect, but I think you can also anticipate that they're going to be very mild.
Should the child be up to date with all vaccines in order to get the COVID vaccine?
So the first part of that question is just in general, yes, your child should be up to date on their vaccines. That's kind of a slightly different topic. Are they required to be up to date for COVID vaccine? They are not. But would we like them to be up to date on their vaccines? Absolutely.
I'll just also add, there is a recommendation out there at the current time from the CDC to avoid other vaccines 2 weeks prior to and 2 weeks after the COVID vaccine. It's kind of a soft recommendation. It's not an absolute requirement. So if your child did get another vaccine within that window, rest assured they're going to be fine. But I do think it's important that if you have an 11-year-old, let's get them up to date right now, so that when they turn 12, they're going to be ready to get that COVID vaccine. And it can take a little bit of planning also for those children who are going to be entering 7th grade next year. Entering 7th grade, they need updated on their tetanus vaccine, their meningitis vaccine, and HPV. And so we just want to not get into a time crunch right before school starts where you want all of these vaccines for your children, and that recommendation is still there, because we try to follow that whenever possible. Though, like I said, it's not an absolute if somebody were to get vaccines within that window.
We have a question from a parent wanting to know why vaccinate their child for a virus that has what they say is a 99% recovery rate.
It's a great question. We hear that one a lot. Thankfully, we know that the COVID infection in children it tends to be more mild in adults. I don't know that the recovery rate is quite that high. We certainly know that children can experience complication. We also are still learning about the long-term complications, that children who have had a COVID infection may experience. I always try and emphasize, prevention is the best medicine. So we are still learning. Can kids get COVID more than one time? Those sorts of things. So by getting the vaccine, again, what you're preventing potentially things, in the future as well. And ultimately, we know that 15,000 children in this country have been hospitalized due to COVID. 300 have died, and we don't want, let's hope that's not one of the children in this local community. But, those are some of the factors, and this is what makes it a really hard choice for families. But I think that's why we feel so confident that even though there's a small chance that your child could be one of those really sick children, we don't want that up for any child.
I would just interject too, Mary Carol. That was such a great answer. And I've thought about 3 reasons why kids should get vaccinated, even though they're at low risk. 1 is that they're not at 0 risk. So for themselves, to protect themselves. 2 is that kids are around vulnerable people. They're around grandparents, they're around maybe other relatives who are immunocompromised, and vaccinating a child who might only have mild COVID, but could infect a vulnerable person protects that other person. So 1, you protect yourself. 2, you protect those that you love around you. And 3, you really protect your community. We really can't achieve community immunity or herd immunity, what people call, if we don't include children in this work. And so if you want to contribute to our community's efforts to get back to normal, and if you want to reduce disease transmission and reduce the likelihood of variants developing, which could theoretically be worse for kids, then we have to get vaccinated.
As a follow-up, someone's asking, since we haven't reached that herd immunity yet, should, as a parent, I be concerned about the fact that the state is lifting mask mandates?
That's a great question. I'll start and then I'll toss it to you, Mary Carol, because I think it's going to warrant both of our brains. I think we're learning about what is needed to return to normal with COVID. We have used traditional understanding of disease to say, okay, we need this level of herd immunity, and then we can all relax. And we're projecting that historical knowledge onto COVID. The reality is we don't know what's going to be needed to safely return. And we do know that there are tremendously significant consequences, especially to kids, because of what we've been through, because of isolation, because of restrictions on activities. And so I think there are a lot of people that are trying really hard to balance our next steps. And so I can't oversimplify and say that it's right or wrong. I can just say that it's hard, and I'm going to trust that the people making decisions are making them with everything in mind.
Yeah, I was also going to just chime in as a parent on this one. So I have 3 children myself. One, my oldest, just turned 12 this year. We got her vaccinated last night. So that's like a sigh of relief. But my other 2 aren't old enough yet to be vaccinated. And so when I think of mask mandates and less people wearing masks out in public, it gives me pause. And to be honest, it gives my kids pause, because they know that's what they have been able to do to help protect themselves and help do something to get us out of this pandemic. And so, I think we have to realize not everybody in our society is eligible for the vaccine right now. And we are protecting, as Dr. Manning mentioned previously, we're watching out for one another. And when you have friends or family or, colleagues who have small children as well, those are some of the vulnerable people because they're not eligible for vaccines. So my family will continue wearing masks because we want to protect the 2 kids who haven't been vaccinated and my one who's incompletely vaccinated. So, those are the things families need to think about. And I think, recognize when you're out in public that families may be experiencing those same situations as well.
That's definitely my hope, that we recognize everybody gets to make a choice and a decision about what works for them. But Mary Carol brings up a good point that I've thought a lot as well about the vaccine decision. And that is, I've also often had parents, as I'm sure Mary Carol has, have said to me, well, what would you do? What would you do with your kids? Which I think is an absolutely fair question to ask a medical provider. What would you do? And I can promise you that the number of physicians, kids that are getting vaccinated it's off the charts. We know and believe that this is the right thing to do. That's just sharing, with you all, what would we do with our kids? We would vaccinate them. We would continue to wear masks because many of them are not going to be able to be vaccinated.
Absolutely.
We've had a couple more questions. I know we touched on this at the top of the hour, but about children who have compromised immune systems, who may be eligible to get the vaccine. Your thoughts?
So that's a fairly broad category. It depends on the nature of the compromise. And again, I'll echo what Dr. Burkhardt said a few questions ago, which is always start with your provider, your healthcare provider who knows your child best. There are a number of health conditions that can compromise your immune system, and it's absolutely fine to get vaccinated. In fact, it's even more important that you get vaccinated because your own immune system may be vulnerable. You might be on certain medications or that affect your immune system, but there may be other even more rare or obscure immune conditions that we would want you to talk to your provider. In general, if you're immunocompromised, your risk with a disease like COVID is greater. And so in general, we want you to be very much considering getting vaccinated, but I want to be careful to not make a general recommendation, not knowing the exact condition.
And just for the common ones that, families may be thinking of, we know, children who are diabetic, children who are asthmatic, children who suffer with obesity, those are definitely safe conditions. So as Dr. Manning said, always check with your provider, but I just want to throw out some of those common ones. Those are kids that we want vaccinated, first and foremost, because they are at most risk.
What if your child has allergies, like many children do in Cincinnati, have cold symptoms, runny nose, sore throat? Would you recommend that they wait to get vaccinated?
It's a great question. So first, to be clear, if they have those symptoms, they might need to be tested for COVID, quite honestly, because we do see a large overlap in those symptoms. So depending on the situation, again, it's always hard to answer something kind of somewhat general, but number one, I might recommend that. Number two, if your child, let's say they've been tested for COVID, it's negative, and they are suffering with allergies, yes, it is definitely safe to get the vaccine. So that is not a contraindication in any way to get it, but I do want to throw that out there. I actually think that's one of the advantages of getting the vaccine that we can tangibly give families this year has been very difficult for children in schools who have symptoms of mild things. So let's say your child does suffer from allergies. Schools can't keep those children in session because they have symptoms of COVID. And so a lot of times those children have been put out of school until they can get a COVID test. And a lot of kids have missed a lot of school for that. And so, and have required multiple COVID tests over the past few months. Moving forward, the more kids that we get vaccinated, the more confident we will be to not be in that situation anymore. And again, end some of these more challenging aspects of the pandemic moving forward. So trying to twist that a little bit into that's one of the great advantages of vaccination long-term, that hopefully we can make some progress on these situations that have been very, very frustrating for families this past year.
So as a follow-up, another mom's asking if a child has had multiple allergic reactions to foods, would they be safe to get the vaccine?
So we're not aware that there's significant overlap between food allergies and reactions to vaccines. We would be concerned if there were vaccine reactions. And very, very early on, there was a concern with one of the, I don't think it was Pfizer, but it might have been, I can't remember, with food allergy and a possible reaction. I will say this, we have had now thousands and thousands of people vaccinated through our own clinics here. We've seen them directly, and we've not had any concern about food reactions and crossover to vaccine reactions. So again, always good to check with your primary care provider, but that would not be a reason to not get vaccinated.
If we're still learning about the long-term effects of the COVID virus, how can we be certain of the long-term effects of the vaccine?
It's another good and very fair question. I think, that's what families are thinking, and that's what families are struggling with. I think I would like to, go back to one of the things I said before. The technology behind this vaccine is not new. We know how vaccines work, and we know how this type of vaccine works. And so that gives me reassurance. I also think we know that other vaccines that are made similarly do not have long-term side effects. That's just not how vaccines scientifically work. And so that is reassuring. I think on the flip side, the long-term effects of the disease we are learning about. I know people have heard about long haulers and people with, prolonged loss of taste, prolonged respiratory symptoms. Those are still evolving. And because this is new, we don't have full answers on those effects, how long they last, what the recovery is. And so that's where I have more confidence, because we have more experience with vaccines and this type of vaccine long-term.
What do you say to a parent who has a child that is scared to get the shot, scared to get the vaccine? What's the best thing to say to the parent to give advice on how to encourage the child?
Boy, we have a lot of experience with that from vaccinating kids and in my own clinic, vaccinating children who might have more anxiety or concerns. The first thing I would say is that we actually have a team here at Children's Hospital of really, really skilled support staff, child life specialists and behavior specialists. And I have seen them work miracles, and I have seen them support families and patients, and some of my own patients, to get a vaccine. And families have said they would never have believed in a million years that they could get their child vaccinated. So there are resources and supports for children who are anxious or fearful here at Children's Hospital. And again, you can always talk to your primary care provider about what supports might exist in their offices. To the child themselves, I would say what I say to a lot of kids about anxiety, and it's that the thinking about the shot is worse than getting the shot. It's anticipating it. And I've witnessed my own patients be so fearful about shots. And then as soon as they get it, of course, they go, that was it. We're all sweating and we've been through all this kind of stuff to help this child. But depending on the age of the child, having that conversation and saying, it's the thinking about it, and we're going to help you thinking about it, and making that be less worrisome, because getting it's going to protect you so much. But I definitely reach out through our scheduling center, through our vaccine clinics, and we can definitely offer support for children who are fearful.
I think that's another area. Parents really know their children best, and how your child is, how they handle getting vaccines, or, a more painful procedure or something like this. So I think knowing your child best in general, as Dr. Manning mentioned, I think the anxiety around vaccines definitely is worse than the actual thing. If you know your child suffers like that, you want to be honest with your child and tell them what's coming. But I sometimes think we don't need to prep children for weeks and weeks and weeks, that they have an appointment on this date. Like, be brief, maybe kind of closer to the appointment time, so that there is not prolonged anxiety about this. It doesn't need to be a big deal. The vaccine is the exact same as other vaccines. It's a very small needle. I always encourage, and I tell our kids this too in the office every day, you are strong, you can handle this. Let's give them positive messaging rather than kind of focusing and feeding into that anxiety. That being said, I totally recognize, parents know their kid best and how they're going to respond.
I have to piggyback on that, Mary Carol, because you made me think of one point that's so critical, and that is that, not in addition to knowing your child best, your child looks to you. They're looking at you. Is this okay? Like, do you think this is okay? And you may have your own anxiety about their anxiety or about the COVID vaccine. But if you want to help your child, you sometimes have to convey exactly what Mary Carol said, which is, this is you're strong, you can do this, and I'm good. So that they take from you that confidence that they can do this. And you might have to keep all that fear that you have inside, which is what we do all the times as moms and parents, isn't it? But I love looking at kids, look at their parents like, is this okay? And how much they take from their parents.
So we have a number of questions about our vaccine clinic. One parent's asking about the next vaccine appointment. On our website shows it's not available till May 27th. Can you do a walk-in appointment?
Yes, you can do a walk-in. We're constantly adding clinic times and expanding our hours, because we don't really want anybody to wait. We're doing walk-ins. We had 33 walk-ins last night. So don't hesitate to walk in and keep trying. I've literally been telling people in the past hour, let's expand. We need to add more appointments. So.
And then what do parents need to bring to their child's vaccine appointment?
Just your child.
Just your child, yeah, just your child. And you don't need a proof of, we believe you when you tell us their birth date, and you might need your insurance card or your, because I think we're collecting that if you have it, but really you just need to bring your child.
Okay. And so people can go to our website, cincinnatichildrens.org, to schedule for vaccine appointments, and encourage folks to keep checking back if they have any questions about their appointment. Okay.
Correct. And we have them at our base campus and at our Liberty campus on different days of the week. So Liberty's Monday and Thursday, base is Wednesday, Thursday, and Saturday. And I'm certain we've got capacity on Saturday. If you walk in tomorrow, we have vaccine, we will vaccinate you.
Okay. And it is the Pfizer vaccine, correct?
Correct.
Can you talk about the potential to make the COVID vaccine mandated? Can a workplace make it mandatory? Can you answer?
So currently, any workplace can sort of do anything. This is quite a hot topic, but many workplaces are not taking that step because it's still under an EUA, an emergency use authorization. And I think that many workplaces, if and when the vaccine is officially approved by the FDA, that will be a consideration. It's lots of things to weigh with that decision, but most workplaces are taking a pause on that decision because we don't have an official FDA approval.
We have a question about a child's weight. Does a child's weight impact getting the vaccine?
It does not. So there is no minimum weight requirement, the age of 12 and up, whether you have a skinny mini little 12-year-old or it doesn't matter. It is not weight based.
I'm going to interject here too, Mary Carol, that we need to mention that not only the clinic here at not our vaccine clinic, but our PPC clinic, as well as many primary pediatric practices in our region, are getting vaccine and giving COVID vaccine. And so we really want vaccination to move into the regular, typical pediatric office setting. We don't really want to have vaccine clinics. We do to get things started and to meet a great demand, but we're very fortunate that the Ohio Department of Health has made ordering vaccine for pediatric offices much easier. And so many offices in the region now are going to be able to offer vaccine very quickly, if not already. Some already are. And so absolutely start with your pediatrician, check with them. That's who knows you, that's who your child knows. It's familiar, it's comfortable. And we truly don't care where kids get vaccinated. We want them to get vaccinated. And we would love to see people move this practice into their pediatric offices.
Can you clarify if the use of aborted fetal cells were used in any type of developing these vaccines?
This is always a very personal type of question, isn't it? That reflects very personal beliefs. And I will confess a little bit of vaccine development ignorance here, but to my knowledge, that is not the case. Not to my knowledge has that type of science been used for this vaccine development.
Just to clarify on that, that is, Dr. Frank has a nice explanation on that on the children's website on the Mythbusters, or the Mythbusters or the question and answer. He's done so many resources. Dr. Frank is the head of the Gamble program here at Children's that has been doing some of the vaccine trials. And so perhaps we could get a link to that website, and he has some really wonderful resources there. But I do believe that's one of the questions that he has addressed. And certainly he, would have the expertise in a way that I don't personally have to respond to that.
Yes, we will get that link sent to this particular parent so they can have all of that information available. Another question we have is about children and COVID. Are they passing the disease at same rates or higher rates than adults?
I can start, and please correct me if I say something wrong, Dr. Manning. There's the science is evolving. So you look at the different studies out there, and some you're seeing that the children are passing it at higher rates than adults, and some slightly lower than adults. The truth is we know they pass the disease. And so the differences in the rates, I think we're learning about as those papers are published. But again, the truth is kids definitely do pass the disease. And again, that's one of the reasons why we need to get them vaccinated, because they're passing it to people who are not eligible or have not gotten the vaccine themselves. And so it's the younger children in the family, it's the newborns that, your aunt or uncle or cousin or whoever has, it's the, child you pass in the grocery store that is not eligible to be vaccinated, that's still at risk from this. And so I think that's what's really important to take home from that.
That's absolutely correct, Mary Carolyn. I would just add that a related question that I got this morning was around, well, are unvaccinated people, and including children, catching COVID more? And I said, it's not that they're catching it more, but the COVID that exists now is more focused in the group of individuals who are not vaccinated. So people who've chosen not to get vaccinated, or kids, we're seeing higher rates of COVID in those groups because they're not vaccinated. And certainly the people who are hospitalized are largely, if not exclusively, not vaccinated. So I think if the disease burden shifts to people who are unvaccinated, and some of those people are kids, then theoretically they're going to be more likely the ones to transmit it. It's not that they're more necessarily contagious, there's just more disease in them because they are unvaccinated. And, Mary Carol said something that just reminded me, even though we've talked about how mild this disease can be in kids and why vaccinate kids if they don't get sick, every time I've seen a COVID positive patient in our hospitalization lists, and it's a baby, it just makes me pause and think, oh my gosh, who would want to have to live through that fear of having a baby that's COVID positive? And we've had babies that are COVID positive. And, we know that it's not a serious disease right now for most kids, but it's hard to predict. And we know that could change with variants. So I say that only by way of example, but it still catches my breath when I see a baby that's COVID positive. We just don't want that.
If my child is vaccinated and is around people who are not, are they safe?
I think you can read this question two ways. So if your child is vaccinated and your child would definitely be safer than if they weren't vaccinated. So nothing, they're still around unvaccinated people. And so that's where that question about masking and whatnot comes in. I think the flip side is, are the unvaccinated people safe around your vaccinated child? And again, I would kind of say the same thing. They're definitely safer because your child has been vaccinated. That's a good thing. But as Dr. Manning mentioned before, we don't know. There's a small chance that your child could be like asymptomatic and still spread it to an unvaccinated person. So I hope I'm not reading too much detail into that. I apologize if I'm getting hung up on the words. Is that how you interpreted that, Dr. Manning?
Yeah, but I think it's a good way to look at it too. It's actually, the risk is probably greater for the unvaccinated person. Now, if you had a child who's vaccinated, but they have other health issues, and we have to worry, a little bit about that vaccine not being 100% protective. I can see parents of a vaccinated child, but who has other conditions, say they have cancer or they have other serious conditions. That family might say, hey, the standard for being around my child is that I want you to be vaccinated. I want to decrease the risk significantly for my child. So that got caught in my head as I heard that question. But in general, I think the risk is greater for the unvaccinated person.
Can you talk about where the vaccination site is inside main campus of the hospital?
Sure. Yeah. Actually, it's right across from the cafeteria. It's in our Sabin auditorium. It's really actually a wonderful connection to our institution's history with vaccine development. So Dr. Sabin was one of two doctors who helped develop the polio vaccine and helped really address a horrible disease that really affected so many individuals back in the 50s and 60s. And but that's where we have it at base in Sabin. So you literally can just park in the C parking lot and go up to C1 and you'll be right there. And then at Liberty, it's in the conference room that is adjacent to, I believe it's near the same day surgery area, but it's very easy. You go in the main entrance and it's very easy to get there. Both are very easy to park and get to.
And just to comment, I had previously mentioned, I did take my daughter there last night. It's a very, Dr. Manning should be very proud. She is responsible for a really great operation. It was very quick in and out. It took us 30 minutes from entering to exit, and that includes a 15-minute wait period at the end, at the time we happened to go. And it was really a fun atmosphere. The kids were excited. The staff I think they were happy to see so many kids coming in, and it was fun to watch the other adolescents afterwards. They were taking selfies and vaxies, proud that they were vaccinated. So it was actually really fun to watch, more as an observer, even.
We have another question. I know we touched on this a little bit earlier about side effects, asking particularly about the risk of thrombosis in kids.
Great question. We have not seen it. The thrombosis risk that came up with the J&J vaccine, certainly J&J is not approved for children. Even with that vaccine, it was exceptionally rare, even rarer than happens in just in the general population or with other medications such as oral contraceptives. And so, but fortunately, we've not seen, there are no reports of that kind of occurrence in kids or related to Pfizer or anything like that.
What would you say to the parent who's questioning what the benefit is for a healthy 12-year-old to get vaccinated now?
That's actually one of my favorite questions. I think we've talked a lot about the medical implications, and yes, your child could be one, we don't know how sick your particular child is going to get. I think of this very pragmatically and practically about the socioeconomic effects that have happened to families this year of if your healthy 12-year-old gets COVID, that means she's out. I'm thinking of my kid, she's out 2 weeks from school. Who is going to watch my kids when they're infected with COVID? I'm going to have to figure out how I can arrange childcare, or do I miss my job? What are the pay implications of being out of work? What is the stress that's adding to my family? I feel like it's all those logistic things. What are the documentation that I need for work and she needs for school? And those are the things that families have struggled with this year. Thankfully, again, most of the kids, if they have recovered, that's fantastic. And obviously that's what we want, the best for everybody. But I think those are the things that families are banging their head against the wall at times, how difficult this past year has been with homeschooling and whatnot. This is what it's taking to end the pandemic, and this is why you should get your 12-year-old vaccinated, so you don't have to go through this, and so no other family has to go through all these hoops and logistics to stay healthy. We have a way to prevent this. Let's do it.
This has been such a hard year, right? And you know who's lost the most is kids. They've lost graduations, they've lost proms, they've lost athletic seasons, and I don't want us to ever have to live through this again. And so if that means that a 12-year-old who might be at very limited risk gets vaccinated to help us get out of this dark period, then I hope they can. I hope they can do it.
Should students going back to school in person get the vaccine being around other adults and students?
If they are age eligible, yes.
Okay. And then another question we have is about children again. I know you guys have talked a couple minutes about this, about children that have compromised immune systems. One particular child here is not able to get the vaccine. What would you say?
So this is if it's about a child who's not eligible to get live vaccines, we see
Yes.
that there are certain conditions that is the case for. This is not a live vaccine, so this would not be one of the vaccines in that category. So if that's where the question is coming from, this would be safe. It is not a live vaccine.
Okay, well, this looks like all of our questions. So thank you both for joining us today. I would like to give you a chance to give your final thoughts again to parents out there who are questioning about whether or not to get their child vaccine. What would you guys say to them?
The first thing I'd say is thank you for just engaging and watching. Those of you who are watching now or who watch in the future, thank you. Thanks for asking your questions and being thoughtful consumers. And I hope that we've shared enough to help you feel comfortable making the decision to vaccinate your child. We strongly support and recommend that. And if we haven't shared enough, then please reach out.
I agree with Dr. Manning and appreciate families being, thoughtful, because this is a really important decision. And I have been telling families, if you're ready today to get vaccinated, absolutely come in. We're going to accommodate you. And if you need longer to think about it, we're going to be here next week, next month, and we're going to be here this summer. We want to be here for you when you need us.
Okay, Thank you both. And we should add that our website, CincinnatiChildren's.org, we have a vaccine resources page. So you can go to that page and get a lot of your questions answered, as well as schedule for the vaccine as well. So thank you everyone for joining us today. And we hope you have a great day.